Thank you, Dr. Sosa, Dr. Dimick. I feel very similar to John and coming here to air some dirty laundry, to tell you the things that we worry about or I worry about on a daily basis, coming from a place of humility and certainly not expertise, but with the from the vision of not only personal development, but professional development for me and the people that I represent. I have no disclosures. I think coming out of a crisis or coming out of a pandemic, for me, the biggest challenge is, do I actually have situational awareness? Situational awareness is defined as having the ability to identify, process, comprehend, and respond to critical elements of information regarding the environment in which you're located. And this is such a complex time that I spend an inordinate amount of effort trying to understand what is happening with other people. I've had more conversations in the last probably 6 months with faculty, middle of the night, on the weekends, just getting an understanding of what's going on, or if I have concerns about how they're doing. It shouldn't be as difficult as described by Inslee in 1995 in this graph, but I think it is critical. So why is this so different? If you think about a singular event and an event happens, the grief cycle can occur when that event has some negative impact on an individual. What's different about the pandemic is an event, but it's actually a series of events that occur on a daily basis. And although as a leader, there's a time period to give information and communicate, to give emotional support, to give guidance and direction, it's very difficult with the pandemic to say this is a singular event, there's a life cycle to it, and there will be closure to it. This is a graph that's very similar to what Dr. Sosa put up of what's occurring with COVID in the North Carolina area. And so not only did we see a peak in the January 2021 time period, we're actually in a worse situation today than we were in January. And so this cycling of events will have a toll on individuals and teams, and understanding what is happening with those teams is critical. The other is, and my concern is that with these cyclical events and what's happening with the pandemic, will our faculty or our teams that we count on get into these grief cycles or sticking, so they get into a fixed phase and they can't get out of that phase. As you can imagine, if an individual gets into a phase of depression, that may lead to a withdrawal or disengagement and have a significant effect not only on that individual, but the impact that individual has on others. Or this cycling, and I think this is actually going to occur, and that is you move backward and repeat previous phases. And I think we're seeing that a little bit right now as we're in a time period where, I got a call today, we need 40 more ICU beds. What are we going to do to mobilize faculty, CRNAs, decrease things that are happening in the operating room? And this is the same thing that people went through before, and I think those triggers can have an effect. It wasn't until I read this, actually in preparation of this talk, that made me think a little bit more introspective about what was going on. The AMA Code of Ethical Ethics had an opinion that they put out recently, and this is how should physicians respond in a disaster or and in preparedness. And I highlight the last part of this opinion. It says, first and foremost, it's the obligation to provide urgent medical care during disasters, an obligation that holds even in the face of greater than usual risk to physicians' own safety, health, or life. Certainly in my career as a surgeon, this is the first time I've been involved in the care of a patient or patients where I'm actually at risk of having a health event. This is very different, I think, than HIV, and not only am I at risk, but I could put my family at risk, my spouse, my kids, my parents, my friends. And so it's a very different perspective, and what are people really thinking about this in terms of how they're coping and moving forward when we need to start moving forward. This was in the Harvard Business Review earlier this year. It's entitled Helping Your Teams Heal. Leaders must recognize people's grief and assist them in finding meaning. And they really break it into three categories of individuals. And if you think about it, and you've had, you lead a large department or a large group of people, you may have people that are in these different buckets. And so as we talk about moving forward out of the pandemic, it's difficult when people are in difficult phases of their recovery. There's the worried well. These are those that have not been affected personally by COVID or someone in their family. They're what we call anticipatory grievers. So they have an anxiety of what's going to happen in terms of loss or sickness. There's the affected, so those that may have been sick but not had a significant consequence from that. But obviously are have a different perspective about the COVID pandemic. And then, of course, there's the bereaved, and we've had this even in our own surgery care division, where we've had somebody that died. And how do those teams respond dealing with that? And those are the ones that maybe lag behind the others just because of the events that they experienced. I think the other is for our physicians and our faculty is all the pressures that are happening related to just the finances of medicine. There's certainly financial and job security concerns. In our department, we held everybody whole as it related to compensation. And I still have people that don't trust me that we're going to do that, and we've been doing it for 18 months. It's just it's a natural concern when you see all these types of headlines of what's going on across the country and how this is being handled perhaps differently in different departments or in different departments. There's a loss of autonomy. I think that Dr. Sosa talked about that in terms of this isn't the job I signed up for, and now you're asking me to do things. And so they feel that loss of autonomy. I think there's an inability to compartmentalize in terms of the social media, all the news. I mean, it's nonstop about what's happening with COVID. So what are the trends likely to shape healthcare after COVID-19? This is from a Becker's report. One is going to be around reform. So an example would be CMS waivers to be able to manage patients outside the hospital or telehealth. There's certainly going to be a greater aspect on health for all, so equitable healthcare outcomes. There's going to be an era of exponential improvement, and will probably be a technology or digital-driven innovation. The concept of fragmented integrated care delivery. So how can you actually manage a patient out of the hospital and give them the same level care and all the support that goes with that? And then a next generation managed care is certainly going to be accelerated. I think employers and payers will certainly look at their sponsored health care coverage and think of different models, probably value-based models. So for me, the biggest challenges are, do I have the skills to be able to lead out of the pandemic? And I think these two concepts will become very important, not just for me, but other leaders in our department. And especially as we have a more horizontal structure in a pandemic, as we're working more closely than we would perhaps in a normal hierarchical situation. But the concept of adaptive leadership and strategic foresight. So adaptive leadership is a concept that focuses on mobilizing people to address complex challenges and still thrive. There's usually three components. There's the situational challenge. What are the behaviors from the team and the leader, and what is the adaptive work or the solutions to execute on that? It does take certain competencies to be able to do that. I already talked about emotional intelligence as it relates to situational awareness, but you have to have self-awareness as a leader. Am I doing the right things? Do I act appropriately when I'm under stress? In terms of character, communication, I think, is the key to this. You need to be transparent, you need to be honest, but you need to communicate. I think it's important to have organizational justice, and this is how can we be fair and honest and equitable in everything that we do, and get involvement from everyone to understand their concerns, criticisms, and view, so they feel valued and respected at what the solutions are going to be. This process will also allow development, so building organizational muscle or competence. Adaptive challenges are different than tactical challenges. Tactical challenges is we already have a solution for this problem. We just need to put the solution in, and that will remedy the problem. And if it happens again, we'll just do the same thing. Or these are usually where the solutions aren't known. The other concept is strategic foresight. So this is discipline to gather and process information about future operating environments, or scenario playing to understand what are the potential futures, so that when you get into situations, you're able to pivot much quicker. These usually occur in what's called a VUCA in microenvironments, so a microenvironment that's volatile, uncertain, there's complexity and ambiguity, and so that you need to come up with different solutions or understand what the futures are and what the solutions would be. And learning about the future is really about learning about change. I'll go through this really quick. This is really about scenario planning. So what are the current conditions? What are those identified driving forces for change? What are some leading indicators that you can put into this? And then you run this model and you look at all the potential alternative futures. And as a result of that, you're able to capitalize on opportunities. I'll just give a quick example of this. Steve Evans gave a talk earlier this year, and he came up with this formula of financial loss plus need for patient connectivity and innovative infrastructures really is going to lead to new models of care. And there's a lot that's happening in the industry world to support this. We as an institute, as a system, set up a virtual hospital to manage our COVID patients. And in the first surge, they managed about 2,700 COVID patients outside the hospital that met criteria typically for inpatient care and had different levels of care that they could accelerate care outside the hospital. Well, we as a surgery department were involved in some of this care, and if you look at all the disconnected things we had in our department, from managing patients with wearables, we had remote monitoring and digital platforms to actually keep track of patients. It was integrated with our EMR, and we had predictive analytics so that if something was happening with a patient, there would be a trigger, an alarm would tell the team member, you need to check in on this patient. We've had prospective randomized trials and virtual care that we used to accelerate virtual care during the pandemic, that we set up what we're calling a surgery at home. And this was, well, if somebody's in the hospital for 5 days, let's get them out of the hospital in 2 days and manage them. But one of the things when we looked at this was, well, what about managing non-surgical patients who don't require surgery and don't let them get admitted to the hospital, like diverticulitis or small bowel obstruction, and started doing this. So I think this is an example of adaptive leadership or adaptation for a better outcome. In the midst of every crisis lies great opportunity. Thank you very much.